Hey guys, it's Dr. Chris from Dressel Chiropractic. I know a lot of us are stuck at home right now, and many of us are still dealing with different levels of aches and pains. And I've received some requests for exercises pertaining to some of these conditions. So here is one for those of us suffering from traveling pain, tingling, numbness, weakness down our legs, often called sciatica.
So here's your 30-second anatomy lesson. The sciatic nerve runs all the way down our legs to our feet and starts in the lower back. These nerves here being circled in slow motion. And when these nerves run together, they form this large sciatic nerve on the right and the large sciatic nerve on the left. So now we can hand this over to our office assistant to demonstrate some exercises.
Me. So, important thing to remember with lower back exercises is that not every lower back injury is the same. Even though the pain feels like it's in the same spot, our backs tend to have a preference for either extension, where our back goes in, or flexion, where our back is coming out. The exercises that your friends or your neighbors or your relatives are doing might not be ones that will make your back feel better. So the important thing is to first figure out, do I feel better with extension? So do I feel better standing, walking, or laying flat? Or do I feel better when I sit down or lean slightly forward, or I kind of curl up my knees a little bit towards my chest? Those are flexion, right? So if you feel better with extension, do extension-based exercises. If you feel better with flexion, do flexion-based exercises. And I'm gonna give you some examples of both right now.
Now, if you feel extension exercises are the ones for you, the first step is to perform the prone laying activity, which essentially looks like nap time. You are going to lay in this position for 2 to 3 minutes to allow your spine to relax and have gravity gently press your lower back into a very mild extension. The next step in our extension progression is the passive prone extension position, where we are laying on our stomachs with our chest propped up on our forearms and our lower back and abs fully relaxed. This is a nice passive way to allow the back to extend. We want to hold this for 30 seconds to about 2 minutes. The final step in our extension protocol is to add the active prone extension exercise, where we are pressing our chest up for a count of 5 and then returning down onto our forearms passively for another 30 seconds to 2 minutes. This can be repeated about 4 to 5 times for a total of about 5 to 10 minutes for this entire extension protocol here. Make sure you are keeping your lower back and stomach nice and relaxed as you perform this exercise. So for those of us who do well with flexion, the first exercise I'm showing is the single leg knee to chest exercise, where you will be pulling up on your shin just below the knee for about 20 to 30 seconds, feeling a good stretch in the glutes and possibly the lower back as well. And then switching to the other leg for another 20 to 30 seconds. Now watch my ankle right here. Bam. I am not keeping it relaxed. Make sure you keep your ankle and your head and neck fully relaxed during this exercise. Now, some people prefer the bilateral, both leg knee to chest, so you can bring both legs up at the same time, grab on and pull up there. I don't think you get as good of a stretch personally, but again, make sure you keep your ankles relaxed. But whatever one works best for you is fine. The next exercise in our flexion protocol is a basic hamstring stretch, where you will sit upright with your feet together and your knees flat and reach as far as you can down towards your toes. If you can reach your toes, that's great. Try to hold the stretch for about 30 seconds to a minute and repeat 2 to 3 times. Try to avoid bouncing if you can like this, as this can stress cold muscles and lead to possible damage. If you feel your knees coming up, you can't hold this stretch properly, drop one leg off the table and stretch one leg at a time. Again, holding for about 30 seconds to a minute. Patients often ask me why a hamstring stretch, because they feel the stretch behind their knee or their thigh, but in reality, the hamstring originates at the pelvis, and a tight hamstring can greatly influence how the lumbar spine behaves. The final stretch in our flexion protocol is a piriformis glute medius stretch, where we are sitting upright just like the hamstring stretch, except this time our knee is bent at 90 degrees and off to the side. Our foot is straight out in front of our torso, and during this stretch, all we do is lean forward over that foot and hold for about 30 seconds. You should feel a pull into the outer part of that hip and butt area. Once that time is up, switch sides, put your other leg up on the table, bend the knee at 90 degrees, and lean straight over your foot. Again, hold for 30 seconds to a minute. Try to make sure you are leaning over your foot and not over to the side over your knee. If this is too easy and you're not feeling a stretch into your hip, there's a more advanced version where you lay flat on your back, you cross one leg and you bend that knee just like before, only this time now you pull up on the opposing leg while keeping your head and neck relaxed, and you should feel a nice stretch through the opposite hip that you're pulling on. After 30 seconds to a minute, you can switch legs.
All right, guys, there's some exercises for you to try. Hopefully they can help to eliminate or at least partially reduce some of the discomfort you're dealing with at home. If you have any questions, please reach out or send me a direct message. I'm happy to communicate with all of you. And if you have any suggestions for videos I should do in the future, please just let me know. All right. I hope you all stay happy and stay healthy, and I'll talk to you all very soon.